the gentlelady from Washington, Dr. Schrier, for her 5 minutes of questioning.
Thank you, Mr. Chairman. Thank you to our witnesses. We're here to discuss the biosecurity risks of the intersection of AI and biology. And while the potential for a bad actor to use AI to design a virus that is as miserable as Ebola and as contagious as measles is terrifying, the most serious biosecurity threats facing the U.S. right now are not theoretical. Measles is already here, it is already killing children, and it does not require AI to spread quickly. All it requires is some gaps in vaccination and a plane flight or a trip to the grocery store. It is one of the most contagious diseases out there. It is entirely vaccine preventable, and no child should have to suffer or die from it. Dr. Havers, what does the ongoing measles outbreak tell us about the consequences when vaccination uptake drops, particularly for children or people who are immunocompromised?
No, that's a great question. I mean, the fact that measles we've had continuous outbreaks of measles for the last 11 months, indicates how important herd immunity is. Certain vaccines are extremely effective that if everyone in the population is vaccinated, the disease will not be able to spread widely through the community. This is maintaining herd immunity for diseases such as measles, where we have an effective vaccine. It protects not only infants too young to be vaccinated, people are immunocompromised and the vaccines don't work, but it protects the entire community. When we've had decades of misinformation and false information about the safety and efficacy of vaccines, and what we're seeing is we're losing herd immunity in settings for pathogens like measles, where herd immunity is critical to stop
because of misinformation spread for decades by RFK Jr. and others like him, sowing doubt. I'm wondering, just as you think about the landscape, and I've asked this to some of your former colleagues, what are some of the other vaccine-preventable diseases that you are worried might reemerge if this trend of sowing misinformation and scaring parents and dropping vaccination rates continues?
I mean, it's possible we'll see the return of polio, for example, but I think what we're already seeing are diseases like Haemophilus influenza B and pneumococcal meningitis, which, as any pediatrician that trained in the 80s, they got very good at doing spinal taps on babies because this is a frequent presentation of devastating invasive bacterial infections. Effective vaccines have basically eliminated those in children in America. But I think young pediatricians now are going to have to get a lot better at doing spinal taps because they are seeing a huge number of unvaccinated children, so they can't rule that out. So even if they don't have that disease, they get more testing.
That's right.
But also we're going to see an increase in pediatric deaths because of those diseases.
And I trained in the 90s and still did a lot of spinal taps. And I just want to just connect some dots between a link there. When kids get these bacterial illnesses, Hib, pneumococcus, then they need antibiotics. And we already have a problem in this country with antibiotic resistance. And I just want to point out that there are more consequences. You know, one is babies dying of these things, but the other is that antibiotics that we use to treat them may not work. We just came through a once-in-a-century pandemic, and you would think that that would have brought our country together, made us more interested in preparedness and more excited about mRNA vaccines. HHS, under the guidance of RFK Jr., just cut almost $600 million from mRNA research. We just had the first case in the country of H5N5 flu, and the patient died of it. And this is exactly why we need mRNA vaccines, which brought us that COVID vaccine in record time. I think the fastest before that was 4 years, and we got it in less than a year. What are the implications of this? Should, for example, H5N5 or even H5N1 start moving like person-to-person transmission?
Well, we know that, I mean, H5N5, the case that you mentioned, was the first time that that virus had ever been detected in a human in the world, not just in the United States. And so that's just a new virus that we have in the last month or two. But H5N1 is a well-known pandemic threat, and it is mutating fast. We have the ability to create a stockpile of H5N1 vaccines should this blow up. That would mean that frontline healthcare workers would have immediate access to life-saving vaccines, so they would not be putting their lives at the same level of risk that they are taking care of patients if this blows up and efficient human-to-human trends happens and we have a pandemic. But yanking the funding from that and from mRNA vaccines, again, takes away one of the strongest tools we have for responding quickly and rolling out a vaccine as quickly as possible. Days and weeks matter at the beginning of a pandemic.
Thank you. And I just want the country to remember the early days of COVID when you were describing what you did and doctors taking care of patients and nurses were dying because of that exposure. We need the vaccines. We need the mRNA research. Thank you, and I yield back.